is Dr. Ghazala Shaikh. I am working as a junior for a medico-legal consultant, and today I am here for continuing my talk on right and duties of doctor. Today is the last and the concluding part of that enormous and numerous duties a doctor has towards the patient, towards the society, towards the other doctors. But today's talk is basically very important duties, is about very important duties of doctors, because all of these duties has legal implications. So let's start. The very first duty I will talk about is emergency medical service. So what do you understand by emergency? Emergency is basically any incident in which there is threat to someone's life or limb. Now these incidents may arise within the body or outside body. Like if somebody is having high blood pressure and he complains of severe numbness in his arms or difficulty in speech, or all of a sudden someone gets chest pain or severe abdominal pain. So these are all causes which are arising within the body, and it needs immediate medical attention, because the person who is having chest pain may end up into cardiac arrest and die. So these are the causes which are emerging from the body. Now there are second cases which are emergencies due to the external causes outside the body, like assault. Somebody hit someone, there is house collapse, or somebody is drowning, or somebody consume poisons, or homicide, or these house collapse, or nowadays terrorist attack, disasters, any disasters in which the casualties are there, loss of human lives are there. So in all these cases, the emergency medical services plays a very important role, and every physician has the duty to provide emergency medical services, irrespective whether it's a government hospital or any private institution. Now this is possible. The emergency medical services in India was not so good before, but we must thank the judiciary for taking initiatives so as the emergency medical services is easily accessible to all of us. Decades back, it was very difficult for the victim or the casualty or the patient to receive the emergency care within the time limit. There was many legal formalities and procedures which needs to be followed in some of the emergencies cases, and there was many lives were lost because of these legal formalities. So the judiciary realized that the Constitution of India, which gives you the fundamental right to life under Article 21, the right to access to emergency medical services is one of the essential part of right to life, and that's why no government hospital or no private hospital or no medical practitioner can refuse the medical service to anyone, any accident victim or any of the patient who is suffering from any of the casualty. Now the guidelines which are laid down by the Honorable Supreme Court of India say that a patient who needs the medical care, he should be admitted first after providing the first aid. Now in Mumbai or in the state of Andhra Pradesh or in some other state also, the state government along with the central government has started the MEMS. This is, or it's also called as 108 services. These services are totally free. If any of your, if you are anywhere on the road, if you see if there is some accident, or at home somebody is critical ill or got some injury or fall, or any of the emergency cases is there, you can dial 108 and the fully equipped medical ambulance along with a doctor is provided to you. The aim of this MEMS is, like I said, it is one of the important initiative taken by the government of India along on the directives of the Supreme Court, that emergency medical care must be provided to every casualty.
What about the money they demand?
No, if they demand money, then you can consult their higher authorities and take action against them, because it is totally free service. They give the first aid and you don't have to pay for that services.
But they say the doctor is now not available.
You can, okay, there are, there are many problems, administrative and technical difficulties, but these I am talking about what is the legal framework for what are the programs which are for the emergency medical services started by the government. Now the first condition is that after providing the first aid, the patient must be admitted in the hospital. Now when we take the patient to government hospital or even in private hospital, like somebody is having critical injury and he needs to be given an ICU care, or sometimes ICU beds are not available. So in that case, the patient has to be given all due care, and the medical officer should make necessary arrangement to transfer this patient to the appropriate healthcare center, where the specific or the better medical care can be provided to that casualty. Now,
but being delayed
huh.
because the bed is not available, delayed, then his condition worsens.
Till the time you are not being admitted, ideally a doctor should accompany your patient. If you have taken to some, or even if in ambulance nowadays doctors are available to take care of the patient during that transfer. That is very important, that you should first ascertain whether the recipient hospital has beds. Sometimes ventilators are not available or the ICU bed is not vacant. So before transferring the patient from one center, like if you have taken the patient to the government hospital or some nearby private hospital, till the time you have not confirmed your bed in another hospital, you should not shift the patient, because it is again become very risky. The patient will be accompanied by a medical officer during this transfer, so as he can document the patient condition, he can assess the patient condition and give appropriate medical treatment or emergency treatment, so as the patient's prognosis becomes better and his condition is not getting deteriorated. And he will write at the end, at the time of handing over the patient to the hospital, he finally has to give you in legible handwriting his complete signature, date and time of transferring that patient, along with the medical treatment he has provided and the condition of the patient. So the receiving hospital has an idea what kind of care will be needed by that patient. So this was about emergency medical services. The doctor is not concerned at all about who has committed that offense, or whether the patient who is brought to him is a criminal or an ordinary citizen. The primary duty of a doctor or the police, if sometime the police brings the patient, in all that cases the doctor should just concern about saving and preserving life. That is the first duty of a medical professional. And if they are not following this, like there are Motor Vehicle Act, which if you won't provide, if you the directives which I have just explained about transferring the patient to the appropriate and better and specific health care center, if these things are not followed and somebody unfortunately lost life, then the doctor can be made liable for this under Motor Vehicle Act. So this is very important for the doctor to handle the emergency medical cases very diligently and with all due care and precautions.
What about the accident
Accident, yeah, accident victim also. The legal formalities can be performed later on, but as soon as the patient is, brought to the hospital, the doctor should, without delaying the any, time, he start the treatment first.
But what about the condition it deteriorates? No public comes because of the police and all this stuff.
If somebody, if like many of the accident cases are, if there is called Good Samaritan law, in which the patient who, who is the witness to some kind of this accident, so for the sake of humanity, if he's coming forward, he is willing to give his time, so he must accompany the patient and give the information to the police later on that he found him here, and these are the conditions. So if you want to save someone's life, definitely you have to coordinate and give some time for calling the ambulance, waiting there, and if you know the first aid, you can give that. So it's a noble cause to save someone's life, and it involves not only the medical professional, citizen is also equally liable for that. Along with, we all have to work as a team here. So that's very important. Yes. Yes. Yeah. There are ideal conditions are never there, but we must try our best, because if you take one action, correctly, then you may save someone's life. The second important duty of a doctor is disclosure of crime. Now, whenever during the course of treatment a doctor come across or become aware of commission or intention of commission of any offence, then he is bound to inform to the police. Now, these are called the MLC cases, medico-legal cases, in which the police has to be informed. And these are particularly related with the offences against public tranquility, the offences affecting life, and offences affecting the adulteration of food and drug. A doctor is duty bound under the IPC to disclose these crimes. Like if a woman has come and he has injuries which are suggestive, sometimes the history also gives clue to the doctor that there is some mischief here, there is some foul play, there is suspicion of some illegal act, then he has to inform the police. He is duty bound to do that. Now, a doctor has to label a case, whether it's a MLC case or non-MLC case. If it's a MLC case, then obviously the role of police is there, and there is no role of concernant there. Sometimes the patient or the relatives, they themselves are not ready that this matter should be called as MLC. But
explain what is a MLC.
MLC is medico-legal cases. Medico-legal cases. Medico-legal cases, they are the medical cases who are having legal implications. A doctor has to inform the police in all these kind of cases. The first, all cases of injuries and burns. All injuries and burns. Second, all vehicular, factory or unnatural accident cases, especially when there is likelihood of patient's death or grievous hurt. Most commonly these are all accident cases. Cases of suspected or evident sexual assault, cases of suspected and evident criminal abortions, cases of unconscious patient where cause of unconsciousness is not clear. Sometime the patient comes along with the police also and it's unconscious state, so in that also become an MLC. All cases of suspected and evident poisoning or intoxication, cases sometime referred from court for age estimation. In that case also it becomes an MLC. Cases brought death with improper history. Roadsiders beggars, sometimes their dead bodies is brought to the hospital, so the PM becomes very important. Postmortem examination, and it's again an MLC case. cases of suspected self-inflictions of injury or attempted suicide. All other cases which are not following under all the above categories but has legal implications. Third is collection of sample and information. The section 201 of IPC deals with punishment for causing disappearance of evidence. Like when the even in the case of emergency, when the patient is brought to the doctor and while collecting the history, he may die, or he has given some important statement when he was conscious. So at that time the doctor has to record all these information, what kind of if he find during his medical examination any important clue which can help the investigating agency, that is police, to solve the case or to help to identify the the person who has committed that offense. So it becomes very important for the doctor to collect that sample and material and hand over to the police.
What about the treatment? Police should give permission to doctor to treat, or what about?
Doctor, as soon as the patient is brought to the doctor, the first primary the duty of the doctor is just to start the treatment. The police or any other person can interfere in the doctor's work.
No, but police evidence should be. Police says our permission should.
They can be performed later on. But if the patient is seriously or critically ill, then the first thing we must do is to give him the immediate care, that is treatment.
So doctor can do the treatment.
Doctors should not be concerned about what are the other circumstances, whether he is a criminal. He has to just save the life.
So sometimes in hospital they say let the police come and report. And
No, you can object that. A doctor cannot delay a treatment by giving the reason of all these legal formalities. It's against the law. Say life is precious, you first save that. Other things can be performed later on, but no life should be lost in and the legal formality should not be an obstacle in saving someone's life. And the patient cannot be detained. Sometimes what happens, it happens in some private nursing home or private hospitals that it's a management part again, that the hospital denies discharge to the patient because they have not paid the fee of hospital fee. But again it becomes illegal confinement under the Indian Penal Code. So in whether the you cannot deny the patient, you cannot detain the patient on grounds of non-payment of the charges.
Who will bear the charges, payment, treatment charges?
You can take other methods of recovery, like you can request them, you can send the letters, you can ask for any other this. But I'm just concerned about the legal implications that a doctor should not. It's a do's and don'ts for the doctors, that because they may trouble if they don't observe or they don't is non-compliance of these duties can make them liable to be prosecuted under various provisions of the acts or the Indian Penal Code. Now the medical profession is considered as a highly noble profession. But nowadays, the trend is totally changed. There is distrust. This doctor-patient relationship is suffering from the distrust and suspicions. And this is because of the increased corporatization of the healthcare system, which is again inevitable in today's scenario. So my message is, I want to now address this entire lecture is for the doctors. It doesn't only call for introspection, but we must be remember that the medical profession is a noble profession and at the same time it's a high risk profession, because you are dealing directly with a human life and whatever action you takes determines, you know, whether that person is going to survive or not. So and this so that's why this noble profession, the self regulation becomes very important. A doctor needs to be sensitive towards his, you know, duty, and the doctor's first duty in any of the circumstances is to save life. He cannot deny this to anyone in any circumstances on any ground, and that's why it's called the noble profession. भगवान का अवतार कहा जाता है डॉक्टर्स को, बिकॉज अगर जिस तरह भगवान जान बचा सकता है वैसे ही डॉक्टर जान बचाते हैं आपकी. तो इसीलिए सोसाइटी ने इतना उनको जो है महत्व दिया है, इतनी इज्जत दी है इस प्रोफेशन को. लेकिन जिस तरह के हालात हो रहे हैं उसमें हमने देखा है कि आज ये प्रोफेशन जो है वो बहुत ज़्यादा दूसरे प्रोफेशन जैसा बन गया है. आजकल डॉक्टर्स की वो इज्जत नहीं रही जो पहले होती थी. तो उसके लिए हम सबको, स्पेशली द मेडिकल फ्रेटर्निटी, start introspecting themselves that why this why this trend is happening. There needs to be again हमको to build that same trust and faith in the public on the medical profession, and the onus of regaining that lost faith and trust of the public lies and waste in us. It's the very heavy duty which is on the heads of the doctors who are practicing today to regain that lost faith of the public in their profession. And it starts with the self-regulation, which is at the heart of this profession. And the society give you there is an implicit contract between the medical professional and the society. The society demands from the doctor accountable, competent and good medical services, and that's why they are ready to give the privilege. So it's not we must remember that the doctor and the society are in a contract. There is an implicit contract between the two parties, and the doctor, the medical services provided by the doctor should be competent and accountable. They must be accountable for their services. Then only they can uphold the nobility of this profession.
We there to look after the doctors.
Yeah.
Done or not, properly done or not. Who are there?
There are medical bodies like you have MCI, Medical Council of India, which has the ethical board on that. So if you come across any doctor which you see has violated any of the rules, you may complain to their professional bodies who take disciplinary action against the doctor. This is a very mild form of correcting someone's, but you must raise your voice. If you see some doctor who is doing wrong things, or so you must report about them to their medical council.
Yeah, but once you take action on a doctor,
Yes.
the entire staff goes on strike.
No, yeah, it's true. It's the reality. Sometimes it's true. Like when we file the cases of medical negligence in the court, and the court asks for the expert opinion. In that time, we see how strong the medical fraternity is towards hiding each other's flaws. Or but this is not in the greater interest of the nobility of this profession. I think that I sometimes people say it's so bad that being a doctor you are fighting against the doctor. You don't have respect or that compassion for your fellow medical practitioner. I always reply them, I love this profession and I want to uphold the dignity and the nobility of this profession, and for that it is very important to pinpoint and punish the wrongdoers. There are many good doctors whose work need to be appreciated. At the same time, the wrongdoers has to get punishment for their negligence. Then only the medical profession will be really will regain that lost faith and trust of the public. And it's happening. It's not like that there are many nowadays the medical students are also trained for the medical ethics. on their communication skill, how to communicate the patient with the patient, how to follow ethical medical practice. So it's not that the situation is altogether very gloomy. There are a ray of hope still in the medical profession. So here are a few suggestions for the doctors, how they can make themselves safe from being prosecuted. The first one, the police are to be informed whenever necessary and all help should be extended to them. Like in case of all MLCs, it becomes a doctor's duty to collect the evidence, to give the information, give the sample in proper legal format, so as it can help the police to investigate the case. Second, documentation is very, very important in medical profession. The condition of the patient, consent, the procedure which performed, the treatment given at the instant time, and anything done to the patient has to be recorded. It has to be recorded with time and signature, because if you have not documented it, it is considered by the court that you have not done that. Legible copies of the medical record should be furnished. This is again a big problem, because some doctors' handwritings are very famous that only the chemist can read that. But it should be legible whenever required by the investigating agency. Nowadays private hospital has, they have to type, even the government hospital has come up with the computers, so there is no question of legible. But in case of private nursing home, or there may be some problems with the doctor's writing, but the code emphasizes that it should be legible, it should be understood by the patients and all. So the last time I have discussed in the rights of the patient that you have a right to access your medical records, which is in possession of the hospital. So you can demand, if you think that if you want to, if you are not satisfied, or there is any suspicion of not proper medical care is provided to you or your family members or relative, in that case you can always ask for the copies of the medical records. You have to apply and pay the requisite fee for that records. Legally, for doctor, consent becomes very important, because anything which is done without the consent, because it directly, it's very, sometimes you have to perform the procedures which are very integral to that person's life or his privacy, so you must take consent. A legally valid consent is therefore must before starting any intimate procedure. Like if you are examining a female patient and if you are male doctor, then you must be accompanied by a female attendant. So consent becomes very important before start of any intimate examination, procedure and treatment. The hospital documents, the medical records must be preserved. Now there are different time periods which is given by Clinical Establishment Act or Medical Council of India and the DGHS, but all the medico-legal cases has to be preserved for, I think, for more than 10 years. It should be preserved for entire time. Because you never know a case which is appearing very simple, it may have some, later on it may come up with some different story. So all the medico-legal cases the records of the medico-legal cases has to be preserved for life. Now one of the important duty of the doctor is also to decide whether to take the case or not, and to decide what the treatment to give. Yes. Now comes the a doctor, when he offer any the person who offers the medical advice or the treatment, he implicitly state that he has the requisite skill and the knowledge to provide that care. So if you go to a doctor, you expect, it's natural for you to expect the proper and competent care. And in case the court, the honorable courts expect that the doctor is duty bound to provide competent care with all due care.
But in the last bill, you
It's
have
right,
said
so
doctor has right to.
yes, the doctor
decide.
has a right to decide whether he should take the case. I am not talking about the emergency. In all other cases, a doctor may decide whether he is competent enough to take that case, or he may refer the case to the concerned speciality.
But he should do the first aid.
Yeah, I am talking about non-emergency situations, sir. In emergency, a doctor can no way refuse the treatment. He has to give. I am talking about the other cases which are not emergency. In the case, a doctor has full right to deny that if I am not capable of doing something, I cannot continue with that treatment. I will say, sorry, I am not able to do it. I am not specialized in this treatment. There is limitations of each and every skills and knowledge. But it's not, the doctor has a right to decide whether to take this case or refuse it. And once he has taken that case, the patient has a right to demand the reasonable care. Reasonable care and skill of the doctor is expected by the patient. And in case if there is any and the doctor will take the case, he will decide what the treatment to give, and he also supervise the administration of that treatment. So all these becomes the duty of a doctor during the treatment. And if he is not complied with any of this duty and the patient suffered some damage, or his health becomes deteriorated, or in case, then the patient has a right to claim for the damages under the medical negligence, because here the Consumer Protection Acts come into the play. Medical services is also one kind of services, so it comes under Consumer Protection Act, and the doctor can be held liable for the medical negligence. But again, it is not very easy, because you have to prove that the doctor has not taken due reasonable care in treating your patient, and that has resulted in injury or further damage in the patient's condition, or may even death. So it's not always very easy to prove. Negligence is a very small word, but for a doctor is a disaster, because you are questioning a doctor's capability, his knowledge and skill. So it's not a very simple charge or allegation. It's a very serious allegation. So you must be very cautious while using the term negligence for a doctor, because his entire credibility, his knowledge, skill, his all his educational qualifications are becomes doubtful. So, and it has a lot of impact on his practice, on his image. So we should be very cautious. But at the end, I would like to give this message to the doctors that we have to introspect ourselves and try our best to regain the lost faith and trust on our profession towards the public. So thank you very much.